You're listening to Ask Dr. Jake. My name is Dr. Jake Tucker from Good Life Family Chiropractic here on the south side of Lincoln, coming to you today with another episode of Health, Hope, and Wholeness. And what I wanted to talk to you today is just some patient questions and testimonies from practice. We get new patients in our office almost every day with questions that you have, you, the listener. And so whether you have these questions or you know someone that has these questions or you just need an answer for a question that you don't even know how to ask yet, the way that you can get in contact with us is number one, through phone. You can call us or text us at 531-289-7100. The other way is via our website. You can go to goodlifefamilychiropractic.com or email me at drjake@goodlifefamilychiropractic.com. And so I wanted to talk to you today. It's more of an arthritis theme when we're talking about overall health and some of the most common questions that I get. I had a couple of patients yesterday, came in brand new. One of them who'd been going to a chiropractor for a few years, and one of them who'd never been to a chiropractor in her life. The first was in her 40s. The second was in her late 60s, Medicare patient. Yeah, and only in town for a few months. She was here visiting family from California, and just wanted to see if there was something I could do for her in the short term because she was dealing with neck pain, shoulder pain, headaches, low back pain, pain running down her leg and from her hip. And I just really felt for both of them, both of them, really on the same trajectory, just on different parts of the path, And we all come to where we're at along a path. Health is a journey more than anything else. And the first young lady, she's been getting adjusted here in town, here in Lincoln, by one of the for lack of a better term, I'll call them wellness chiropractic clinics. They specialize in wellness chiropractic adjustments. They take cash only. They don't do insurance work. And that's all well and good. There's a place for those types of practices here, but she'd never had an x-ray, and she wasn't going to them for wellness. She wanted to be well, but she was dealing with some pretty significant pain in her neck. And so we did an exam. I saw severe nerve irritation, some potential nerve damage going on in her neck. And so I took an SEMG to confirm it, and then I took an x-ray to see what was causing it. And what I saw is, when I looked at her from the side, is she had lost over 2/3 of the curve in her neck. You're supposed to have this smooth 45-degree curve when you're looking at it from the side, and she was down below 15 degrees. And so I also looked at the spacing between the joints because you don't keep healthy bones and healthy joints when the vertebrae are stuck out of alignment. And so when I looked at the apex of where the cervical curve was supposed to be, it had undergone the most arthritic damage. Something called Wolff's Law governs arthritis, and especially degenerative arthritis. And basically, to summarize what Wolff's Law is that the amount of time that a joint has been malfunctioning or misaligned or not moving properly is directly correlated to the amount of arthritis that builds up. And so basically, you go through 4 phases of arthritis. First, you go through phase 0. Phase 0 is no arthritis, perfect curve, no degenerative changes. It's healthy. It'll always be healthy so long as you maintain it. But the problem comes when it gets out of alignment. And that's phase 1. Phase 1 is out of alignment. For you to learn a phase 1 condition, you either have to have severe trauma or you have to have had enough trauma and really stress, physical, chemical, or emotional stress, for between 8 to 10 years for it to stick like that. For you to show up on x-ray with, a misalignment of your spine, that means that vertebra had enough stress placed on it physically, emotionally, or chemically for 8 to 10 years to be like that. The second level that we see with that is phase 2 degeneration. That's actually where we start to see bony changes, and we start to see a thinning of the joint space. And as that happens, that we can really time that back and say that that's been between 10 to 18 years of that being out of alignment, malfunctioning. Now, most people do not feel arthritis until it's in phase 2. So for them to come in with a neck pain that's arthritis related, it usually means that the problem was between 10 and 18 years beforehand. Then phase 3 is 18 to 25 or more years out of alignment. The further down the line we get, the more variance there is in this. But this is where we've started to grow such substantial bone spurs that you're at risk for it progressing directly into phase 4, which is where the bones actually fuse together, the joint space completely disappears, and you are bone on bone with almost zero mobility. I do not see many people in phase 4 because people in phase 4 don't last very long. The effects on their health is devastating just because of all the inflammation that creates. It creates such severe distress in your central nervous system, creating such a severe sympathetic tone, a stressed neurological pattern that disrupts the brain patterns and being able to heal the body properly. So that's the level at which I have to tell people that I can't help them. At phase 3 arthritis, we're looking at a potential for about 80% correction. And, the good news is with that, we can halt the progression of phase 3 degenerative arthritis, depending on how willing you are to put the work in. And then phase 2 arthritis, usually we're looking at about 90 to 95% correction. Phase 1 is completely correctable, again, provided you're willing to put the work in and take responsibility for your health condition. And then phase 0, obviously you're in the normal phase. But this is something that nobody had ever told these ladies about before. So the first young lady in her 40s, we showed her the x-ray. We showed her where her spine was, and she was just amazed that it was as bad as it was, provided how much care that she'd received over the years. But I told her, look, this is something we specialize in correcting. Let's get you adjusted and see how you respond so I can finalize my recommendations and see exactly how long this is going to take and how much it's going to cost. And so she did. She got adjusted, and she said she felt amazing after the adjustment. Her range of motion improved dramatically, almost back to full. And remember, this is someone who has phase 2 degeneration in her spine that has had that problem building for between 10 and 18 years. And so that's incredible. Now, the young lady, our 65-plus-year-old, her chief complaint, yes, it was the neck pain, the back pain, the shoulder pain, the low back pain, the sciatica running down her leg. But even more than that, one of the biggest issues that we ran into on her initial visit was the amount of depression that she was going through. She was severely depressed on some major antidepressant medications, dangerously so, and things that she didn't want to take. She was trying to take less than what the doctors were recommending, but she wasn't feeling like she was getting anywhere. And when we looked at her spine, not only had she lost the curve in her neck, but the degeneration was such that she was in phase 3 and late phase 3. This is more than 25 years of being out of alignment, malfunctioning joints, pressure and damage to the spinal cord because of it, and pressure and damage to the brainstem as well. And when we looked at her, her entire spine was in a severe sympathetic tone. She was just constantly under stress. And I was amazed that she was as functional as she was. But when I showed it to her, it just made complete sense what she was going through. The degeneration had started to buckle, it had become unstable. It was creating scoliosis in her spine. And just from a scoliosis perspective, that's like having type 2 diabetes. It actually starts to reduce your life expectancy and quality of life to the extent that you reduce that by somewhere between 14 and 20 years is what you're looking at when you have scoliosis. And that's all neurological. That's all the pressure and damage happening at the neurological level. And so, we sat her down, we adjusted her to see how she would respond. And again, same thing. She got up off the table with so much more mobility in her neck that she was able to virtually walk out of the office pain-free. Now, does that happen every time? Absolutely not. Not everybody responds the exact same way to every single adjustment. I've had patients get up off the table in a little bit more pain because we moved an arthritic joint, but that's okay. That's okay. That tells us what the response is, how well you can move to an adjustment. A negative response to one adjustment is actually a good thing. It tells the doctor how to adjust better in the future. And so I always text my patients after their initial visit to the office to see how they're responding so that we can tailor the adjustment to each and every patient. And during the tour, I talk about how in the Bay, I use a combination, and it varies per patient, but we use a combination of drop table, manual adjusting, and arthrostim adjusting. And I also have an activator available if necessary to tailor the adjustments to what every individual patient needs and what their health goals are so that we can help you achieve your health goals. If you've never had a chiropractic exam before, we do things here in our office to the level of a neurologist. Your testing is at the same level as that of a neurologist here in the office, so that we can get to the cause of your problem, to see if your nervous system is healing and functioning the way that God designed it to, so that you can begin to achieve the full level of health and correction that you deserve. And so if you've never had that test done before, we are offering the first 5 callers today a 50% discount off of exam, any necessary imaging or x-rays. That includes a full surface electromyography, digital nerve scan, and that includes digital x-rays. At the most, you'll be paying $65 for that exam and those x-rays. If we do need to do additional treatments that day, those will also be subject to that same 50% discount. But that first visit, the exam and the x-rays and the consultation, that's $65 for that. Only if you call now and you set up an appointment for this week. That's 531-289-7100. Yes, we have weekend hours. Absolutely. We can get you here. We have patients coming from all across Nebraska, from as far away as Fremont and Columbus, all the way here to the south side of Lincoln, to get the care that they need, to get hope back for their health. So again, that number, 531-289-7100. So if you're watching on Facebook, I hope that you're able to tune into Facebook. You can follow along with what we're doing. I always have a slideshow presentation video going to go alongside of the radio show. You can find me facebook.com/AskDrJake, the clinic page. Facebook.com/MaxLifeLincoln, or you can go to GoodLifeFamilyChiropractic.com. There are more resources available there, including our 21-day challenge that we're doing right now. We're in the middle of week 2, and we're seeing people start shedding weight, starting to lose that quarantine 15 that everybody's put on. It's not just the freshmen going back to college in the next couple of weeks that are going to be adding that weight. It's all of us that have been stuck at home eating candy bars, drinking Dr. Pepper, and not getting up off of our couch to get outside and exercise. So we're in the middle of a 21-day challenge to help combat some of those things. We implement all 5 essentials as we do that. If you're interested in that, go to our Facebook page, facebook.com/MaxLifeLincoln, and we'll definitely take you through exactly whatever it is that you need in order to get back on track. We had another patient come in yesterday for her first adjustment. And she was wondering about the nutrition side of things, and if we could help her lose weight. And I said, absolutely, we can help you lose weight. But the first thing that we have to do anytime we're looking at metabolism issues or digestive issues, or even digestive issues that are creating neurological issues, is that we have to make sure the central nervous system is functioning well first. And she responded beautifully to her adjustment. She didn't even realize how much loss of motion she had undergone, and coming up off of that table, she just felt incredible. A little stiff and a little sore, but she was moving so much more beautifully and felt awesome and able to go back to work. So again, call us 531-289-7100, and I'll see you again on Monday for another episode of Ask Dr. Jake.